Insight, innovation and inspiration. Welcome to our YouTube channel Earth RX. In this video, I am going to cover the disease called Kushta. One patch, just a small patch on the skin. You look at it and think it's nothing. It will go away. But what if that patch slowly changes your skin color? What if the place you touch stops feeling anything at all? And you don't even realize that something inside you is dying? The Acharya described centuries ago a disease that discolors the skin, steals the sensation, disturbs, sweating, if ignored, slowly consumes the body. This is not just a skin problem, it moves silently towards the nerves, towards sensation, towards identity itself. The most terrifying part is there is no pain in the beginning. And when there is no pain, people don't take it seriously. By the time you understand the disease has already reshaped the body, Kushta just a skin disease? Or is it silent destroyer hiding beneath the surface? Today we uncover it layer by layer. Now the real question is, why does Kushta develop? Acharyas clearly mentioned the cause of the Kushta. That is wrong food combination, heavy, oily, incompatible diet, eating before the previous meal digest, exercising immediately after the heavy meals, suppressing the natural urges, sleeping during the daytime, improper panchakarmas, vyamana, virechana, basti, nasya, done incorrectly, excess intake of curd, fish, salt, sour food, fresh grains, black gram, sesame and jaggery. Even a sexual activity during indigestion also causes Kushta. And according to Sushruta, unethical behavior and sinful acts also disturb the system. This is not a random, this is a pattern of lifestyle disturbances. Kushta doesn't start from on the skin, it starts in the habits. Listen carefully because the cause of this disease might already be in your routine. What if I tell you Kushta is not caused by just one mistake, not just wrong food like meat with milk, not just jumping into cold water after intense heat, not just suppressing vomiting? What if the cause can come from your parents? Yes, Sushruta says when Shukra and Shonita are vitiated, the child born may also carry the Kushta. And some types, Pundarika and Kakanaka, are declared as Asadhya. But it doesn't stop there. Just touching, just sitting together, just breathing the same air, just wearing the same clothes. Ancient texts describe it as Aupasargika, that is contagious. Yes. And then come the most frightening statement: if a patient dies with the Kushta, it may follow him even in the next birth. Imagine a disease that does not start from your skin, but it is from the blood. Ancient Acharyas describe it as Raktaja, Krimija and then Tridoshaja, a disease where all the three doshas are raised together. Vat, Pitta, Kapha simultaneously are disturbed. And when they rise together, they don't stay floating. They enter directly into your Tvaka, Rakta, Mamsa and Ambu. Four dhatus loosened, weakened, invaded. And once they settle there, they don't create one disease, they create 18 varieties of Kushta. Not one is Ekadoshaja, not one is simple. So, this is why Kushta is not mild. It involves blood, it involves the tissues, it involves the parasites, it involves all the three doshas in our body. And Sushruta says Vata, Pitta, Kapha and even Krimi are present in every form. And some texts even says sinful acts, violence, harm to the innocent may manifest as this disease. It's not just a patch, it's not just a discoloration, it's a systemic storm starting from Nidana. ending in dhatu destruction. Now tell me, can we still call it as simple skin disease? No, you can't say this. What actually happens inside our body before that first patches appears? Because kusta does not start on your skin, it starts with your mistake. When nidana is repeated consumed, pitta and kapha rise first, then vata follows, and when all the three doshas are raised together, it is no longer imbalance, it's a storm. They enter the blood vessel first, move unpredictable direction, searching for a weak spot. And where do they find weakness? In dhatus that have become a loose. Tvaka, rakta, mamsa, ambu. And once they settle there, they don't just stay quietly. They create a moisture, putrefaction, sweat and exudation. And this environment favors the microscopic cremies, tiny destructive forces that begin eating hair, skin, tendons, vessels, even cartilage also going to be destroyed. That is why Acharyas clearly says not a single kusta is ekadoshaja. All the three doshas are always involved. So, when you see a patch on your skin, understand you are witnessing your final expression of deeply disturbed internal mechanism. So, what are the sanchara sthana? So, through vessels, the doshas get aggravate and spread in all our body. Udbhava sthana is in the peripheral tissue. The vector sthana of the kusta is mainly skin. This is not a surface disorder, it is a systemic from the beginning before the kusta become visible. So imagine this, one area of your skin suddenly feel numb or it sweats excessively, it stops sweating completely. Would you ignore it? What if a small wound appear quickly but heal very slowly? What if itching, tingling, goosebumps, discoloration start appearing without a reason? These are not a symptoms, these are Purvarupa. Acharya described this disease as a chirakari, slow, persistent, silent, blackish discoloration of blood, roughness in the skin. It begins in the shaka first, moves through the sira, dhamani, and finally manifests in tvacha. So when you see it, it has already traveled inside you. What if I tell you Ayurveda doesn't describe just one type of kusta, it describes 18 types of different types of kusta. So 7 are called as Mahakusta, these are severe destructive. The 11 are Shudra Kusta, that is milder but equally important. And here is the twist, each type behave differently based on Vata, Pitta, Kapha predominance. Before we jump into the 18 classification, you must understand the dosha-wise lakshanas. Otherwise, you will never understand the kusta properly. Let's see the Vata Pradhana Kusta. So in Vata Pradhana Kusta, there you can be seen dryness, constriction, loss of sensation, shortening of limbs, cracking skin, loss of voice. You can see. Why does Vata destroys like this? What is the mechanism behind the contraction and degeneration? Pitta Pradhana Kusta, ulceration, suppuration, redness, even falling of fingers, ears and nose. You can see in the image what are the Pitta Pradhana Kustas in the display. Why does Pitta burns the tissue so aggressively? Why do creamy appear in the lesions? This is where inflammation and tissue necrosis enter the story. So let's see the Kapha Pradhana Kusta. Itching, discoloration, swelling, oozing, heaviness. These are the lakshanas of Kapha Pradhana Kusta. Not destructive like Pitta, not degenerative like Vata, but slow, stubborn and chronic. And this type of is misdiagnosed in clinics. Now comes the real shock. Ayurveda didn't stop at dosha classification. It named 18 specific varieties, 7 Mahakustas, 11 Shudra Kustas, each with unique morphology, progression, and prognosis. If you don't know the difference between Mahakusta and Shudra Kusta, you cannot decide the prognosis. By the end of this video, you will not see a skin disease as a just skin disease. You will start seeing dosha patterns, tissue involvement, and disease progression. So stay with me. Let's decode the kushta from dosha to destruction, from lakshana to classification. Imagine diagnosing a skin disease, but before touching the lesion, you already know which dosha is dominating, which tissue is affected, and whether it will destroy the body or just disturb the body. What if I tell you Ayurveda described 18 types of kushta thousands of years ago and even classified them differently into two great samhitas? Today we are entering the battlefield of Mahakushta, Shudra Kushta, and the powerful debate between Sushruta Samhita, Charaka Samhita. Not a single kushta is ekadosha. In reality, every lesion carries a vata, pitta, and kapha, but one will dominate in the battlefield. Why this Kapala is said to be vata dominant? Why is Mandala kapha dominant? Why is Audumbara pitta dominant? Why is Kalanaka is Tridoshaja? If you understand this, you can predict the morphology before it fully develops. What if examiner asks which kushta is vata kapha predominant, which is pitta kapha, which is Tridoshaja? Most students confuse here, but today I will make this impossible to forget. So start with the method of examination. So in the method of examination, we are seeing the darshana sparshana of this examination of kushta. Let's see the skin anatomy. The skin is the largest organ in the human body. It is primarily made of three layers: epidermis, dermis, and hypodermis. In epidermis, we have layers, that is stratum corneum, stratum lucidium, stratum granulosum, stratum spinosum, stratum basale, as you can see in the image. So, Ayurvedic view, we have 7 layers of skin, that is Avabhasini. It is a 1/8 of Vrihi, that is called stratum corneum. It compared with the stratum corneum. In Lohita, 1/16 of Vrihi, it is stratum lucidium. The Shweta is 1/12 of Vrihi, stratum granulosum. Another one is Tamra, that is 1/8 of Vrihi, that is Malphagian layer. Another one is Vedini, 1/5 of Vrihi, papillary layer. Another one is Rohini, 1 Vrihi, it is reticular layer. Mamsadhara, that is 2 Vrihi, that is a subcutaneous or muscular layer. We have different types of skin lesions. First one is maculae. It is a flat colored lesion. It is less than 2 cm in diameter. Another one is patch. It is a flat, large, more than 2 cm. It is a colored lesion. You can see in the image for maculae and patch. So another one is papillae. In the image you can see a small solid raised lesion. It is less than 0.5 cm in diameter. Next one is nodule. You can see in the image a large firm raised lesion. It is 0.5 to 5 cm in diameter. Another one is a tumor, a solid raised growth more than 5 cm in diameter. Next one is plaque. You can see in the image plaque. It is a large, more than 1 cm, flat topped raised lesion. Example you can see in the psoriasis plaques. So another one is vesicles. It is a small fluid filled lesion. It is mostly less than 0.5 cm in diameter. Lesions are translucent. Bulla, it is a fluid filled lesion more than 0.5 cm in diameter. Next one is fistula. Fistule, a vesicle filled with leukocytes. Last one is cyst. It is a soft, raised, encapsulated lesion filled with semi-solid or liquid. The Vataja Lakshanas of Kushta in an Ayurvedic view, that is Tvaka Sankocha, that is constriction of the skin. Tvaka Swapa, it is loss of sensation. Sweda, sweating. Sofa, it is swelling. Veda, it is cracking of the skin. Kaunya, it is loss of fingers. Swara Upagata, it is hoarseness of the voice. Next, see the Pittaja Lakshana of Kushta, and you can see the image also, what it's how it look like. In the Pittaja Lakshana, we can see the Paka, Avadharana, it is cracking, Agnyulipata, and Daha, Raga, and then Strava, we can see in the Pittaja Lakshana. In Kafaja Lakshanas, we can see the Kleda, as you can see in the image. Kandu can be seen, Varna Beda, and Sofa, and Strava, Gaurava also seen in the Kafa. So let's compare the 18 types of Kushta into the modern correlation. What are the contemporary aspect we have? So in Mahakushta, we have first is Kapala. Kapala compared with, probably it is tubercular eczema and pneumolar eczema. Next one is Udumbara. It is probable correlation with the allergic vasculitis, ulcers. So in Mandala, it is compared with psoriasis, tinea variant also. In Rishya Jivha, it is compared with lichen planus, it is melanoma. Pundarika type compared with discoid lupus erythematous. Chidma Kushta compared with tinea versicolor. Kakanaka is compared with primary septicemia. The Eka Kushta types is compared with chronic plaque psoriasis, ichthyosis vulgaris, and Charma Kushta is compared with lichen planus. Kitiba Kushta compared with atopic dermatitis. We can see the what are the features we have in the compared aspect. So next one is Vaipadika, that is palmoplantar psoriasis. Alasaka compared with allergic dermatitis. Dadru Kushta compared with the fungal tinea skin lesions. Charmadala compared with pyoderma, and Pama compared with scabies. Vispota compared with exanthema, folliculitis, and Sataru compared with pyoderma, seborrheic dermatitis. In Vicharika, it compared with weeping eczema. Let's come to the interesting part of our video, that is each of the 18 varieties we are going to give a with image. I am going to explain the nature and associated symptoms and what are the contemporary aspect we have. So the first one is Kapala Kushta. Kapala Kushta is mainly because of Vata dosha predominance. The color of Kapala Kushta is Krishna Aruna, and the nature is Kapala. So it is a Ruksha and Parusha, when and Tanu also, when you touch the Kapala Kushta, and the associated symptoms are Toda. It may be correlated with the tubercular leprosy. It is the solitary skin lesion that are asymmetrically distributed. So it is the hypopigmented patches you can see. Sensory loss also we can see in the Kapala Kushta. Because of the peripheral nerves what we have in the trunks may show the thickening in this Kapala. Kapala Kushta also compared with the pneumolar eczema. It is the allergy related disorder which is itchy coiny shaped patches you can see in the pneumolar eczema. Second one is Udumbara Kushta. Mainly it is of Pitta dominant. You can see in the image the Udumbara Kushta look like a Udumbara Phala. The nature of this Udumbara Kushta is Raga. Hair on the patches become brown color. The associated symptoms of Udumbara Kushta is Daha, Kandu, Ruja. It correlated with the allergic vasculitis in the modern. It is the inflammation and damage to the blood vessels of the skin. It is located in legs, buttocks, trunks, associated with blisters, purple colored patches you can see in the image, and all type of ulcer also seen in the Udumbara Kushta. The third Kushta will be Mandala Kushta. So Mandala Kushta is mainly of Kapha predominant. So the color of Mandala Kushta is Shweta Raktam. You can see in the image the nature of the Mandala Kushta is Sthira, Snigdha and Utsanna, and associated symptoms of this is matted. The correlation of Mandala Kushta is mainly tinea variants, psoriasis vulgaris and pityriasis rosea. It is the usually a round or oval patch on the chest, belly or back. See, the fourth Kushta is Rishyajimha, mainly because of it is the dominant dosha will be Vata and Pitta, color will be Rakta and then Shava, nature will be Karkasha, it is hard and rough, it appears like a Rishyajimha. So, the Rishyajimha is associated with the Svedana, there will be a sweating, mainly it is correlated with melanoma. It is a type of skin cancer which have the changes in size, shape, color or feel of a mole. And also compared with lichen planus, it is a raised asymmetrical irregular border lesion you can see. Next one is the Pundarika Kushta. Pundarika Kushta, as you can see in the image, on the face of the person there will be a it looks like a lotus. That's why it is compared with the Pundarika. The color of this Pundarika Kushta will be Shweta and Rakta. Nature will be Raga and Raga. The white and red color, it resembles the lotus petals. So it is inflamed with the red color. The correlation of this Pundarika Kushta is discoid lupus erythematous. It is a condition of source with the inflammation in the face, mainly ears and scalp. So what is the cause of this Pundarika Kushta is, it is mainly autoimmune with the body's immune system incorrectly attacking the normal skin. The next one is Sidma Kushta. Sidma Kushta is the Vata Kapha predominant Kushta. The color of Sidma Kushta is Shweta Tamra. It is whitish or coppery can be seen. Nature of this Kushta will be Tanu, Grushta and then Vimuchi. Thin scales can be seen in the Sidma Kushta. The correlation of this Sidma Kushta into tinea variant. Psoriasis vesicolor is a common skin disease. It is caused by yeast-like fungus. The next one is Kakanda Kushta. The Kakanda Kushta is because of Tridosha. The color of this Kushta will be, it is similar to the Gunja seeds. So the nature will be Sapaka, matlab suppuration. So the main associated symptoms will be Tivra Vedana, nothing but it is the painful one. It is mainly correlated with the toxic epidermal necrolysis, septicemia, as you can see in the image. So it can begin with the spiking fever, chills and rapid heart septicemia. The next one is Eka Kushta. Eka Kushta is because of Vata and Kapha. So it does not perspire. It spreads on a large surface area. It appears like a fish scales. As you can see in the image, it is mainly correlated with the black psoriasis patches. It may be a nose sweating. It is completely dry and itchy. So also compared with the Ichthyosis vulgaris, it is dry, thickened and scaly Charmakya. It is the Charma Kushta. Charma Kushta, in Charma Kushta we can see the Charma in similar to the elephant skin. It is mainly correlated with the lichen planus. It is the single cluster of the lesion. Oval greyish brown marks appearing on the face, necks, limbs and trunks without inflammatory phase. Kitipa kusta is Vata Kapha predominant kusta. It is the lesions are black in color. It look like an ulcers. So it is rough in touch and dry. It is mainly correlated with erythrodermic psoriasis. Mainly we can see the silvery scales, itching, burnt skin like appearance, and blisters also can see in this kusta. Vipadika kusta. So in Vipadika kusta, it is mainly because of kapha and then vata. So the lesions what we can see in the Vipadika kusta. So these are cracks in the palms, soles mainly. So it is also associated with the severe pain. So mainly the correlation of this Vipadika kusta into palmoplantar psoriasis. So thickening, scaling of the skin with the formation of deep painful fissures on the palms, soles. As you can see in the image, palmoplantar pustulosis is the appearance of deep yellowish pustules. Alasaka. Alasaka is a type of kusta where vata and kapha will be predominant. These lesions with severe itching, as you can see in the image, these are the red color produces maculopapular eruptions. So the pink color nodules commonly located on extensor surface of the extremities. It can seen in the allergic dermatitis, itching, inflammation, and warmth of exposed area. There may be a rash and swelling also can be seen. So the next one is Dadru kusta. Dadru kusta is mainly of pitta and then kapha. So pitta and kapha cause itching, reddish nodules, elevated circular lesions in the, as you can see in the image. So tinea is the main name of the group of a disease caused by a fungus. It includes ringworm, athlete's foot, jock itch. Tinea can spread by touching an infected person pets. So Charmadala is mainly because of pitta and then kapha. It is mainly in red color, painful, itching lesions and associated with the blisters, intolerant to touch. Lesion simplex is the correlation. It is a chronic itchy skin disorder characterized by well demarcated erythematous patches and plaques of a thickened leathery skin. So the next one is Pama. What is Pama? It is the pitta and kapha predominant kusta. It is small, numerous vesicular lesion with a burning sensation. Pruritus can be seen in this dorsum of the palms. So it occurs in the waist, buttocks, called kachu. So it is correlated with mainly scabies, pimple-like irritations, or intense itching sores by scratching. The scabies caused by microscopic mite, Sacroptus scabi. Vispota. So the Vispota kusta is pitta kapha predominant. The lesion is black in color, reddish blisters with a thin skin. It is mainly occurring the lips. So it can be compared with impetigo folliculitis. It is mainly a common skin disease where hair follicle become inflamed or infected. It can appear anywhere hair covered skin, but it is the most common on the buttocks, arms and legs. Satara kusta, it is the pitta kapha. It is multiple red blackish ulcerative lesions seen in the image associated with burning, sensation and pain. So pyoderma granulosum is the correlation. It is causes large painful sores on the skin, most often on the legs. So Visharchika, it is due to kapha. Visharchika is the blackish boils what we can seen in the Visharchika. It is also discharge and itching sensation can also be seen here. Compared with weeping eczema and dermatitis, the skin inflamed and bleed gradually becomes quite raw, crusty, later it developed weeping eczema. The sadhya asadhyata of kushta. The sadhya kushtas are vata kafaja kushta. Ekadoshada kushta can be sadhya. And kricha sadhya is kafa pittaja, vata pittaja. Those kushtas are kricha sadhya. Asadhya are tridoshaja, balarahita rogi, and trishna, dahayukta. These are kushta is asadhya. In the OPD by sitting, what are the examination you are going to done? I will tell you what are the examination you should do when the patient of this type of when come to the OPD. Look at the patch carefully and it is identify the color of the patch and then identify the color like it is shweta, rakta or shava, white is reddish or any another color is can be seen. Observe carefully and observe the shape of the lesion. It is regular, circular or irregular. It is spreading silently. And what is the onset and what is the duration? See, ask the patient what is the duration and observe for the margin in which how much surface it is going to be covered, sharply defined like a boundary or slowly merging with the normal skin. So and then the most dangerous sign will be the patient says, "Doctor, I don't feel anything there." So now this is not just a skin disease, this is the nerve involvement hiding behind the color. So if I show you a white patch, will you ignore it? If I show you a raised lesion, will you just call it allergy? No. But in kushta, color is the first clue, shape is the second clue, surface is the third clue. So dry means vata, red and burning means pitta, thick and oily means kapha. But the real twist is when the skin changes and sensation disappears. That's when the story becomes very serious. Thank you for watching the video. For more videos, subscribe my YouTube channel and follow in Instagram account. Thank you.